I'm curious about your research. How did you get started in looking at maternal health outcomes for Black families?
Yeah, I would say I got started by choosing UAlbany as the place where I wanted to start my doctoral career. I was really interested in this work based on the current study that my PI was running, which is the baby study. And so I've always been interested in like marginalized populations and how different cultural and contextual factors affect their mental health. And with this study, we were really attacking a problem that's been widespread for so long, but there hasn't been as many focused studies that are looking into what's actually happening with this population. We know that the maternal morbidity for Black women is so high, but why is it high? Why are we having these issues? And so to be a part of a study that was like specifically looking into this, but also working with this population was something that was like very valuable for me when I was considering where I wanted to start my doctoral journey.
Yeah, so this was like something that UAlbany was already researching, a study that they were already part of, and you were like, I'm interested in that.
Yeah. So my PI, Dr. Lynn, this is her funded study, and it was one of the biggest things that drew me to UAlbany.
Very cool.
Yeah.
And so, what have you specifically been doing as part of this research and study?
Yeah, so specifically for this study, we do study visits where we are interacting with the moms and the fathers and the babies, and we're getting a range of things from physiological data to doing interviews where we're basically asking them about the different risks and supports that affect them from during the prenatal stage until shortly after. And we're really trying to get at what are these mechanisms that are either helping or hurting them during their pregnancy.
Mm-hmm.
Yeah.
What are some of the things that you're hearing from these moms?
Yeah, that's a great question. I would say that it's a variety of things. I would say that depending on, you know, the mom, it could be anything from like environmental factors to familial factors and how that may affect their birthing outcomes, also as well as, you know, just thinking about how like the type of support that they get really impacts them. I think support is a very big thing, and a lot of moms talk about whether or not they have a lot of support and how that's made pregnancy such a beautiful thing, or on the opposite side, how they've lacked support and that has kind of like affected how much that they struggle through pregnancy. And so that's something that I've noticed has come up.
Mm-hmm. Yeah. What would be some examples of, you said environmental factors, like what are some of those issues? Is it like a financial thing?
Yeah, so it would be a mix of it being either economic hardship or a financial thing, or just being like basic necessity. Do they have a place to live? Do they have like quality health care? Do they have quality resources? Are they able to go to their prenatal appointments? And are they able to have like efficient transportation to get to these appointments? And so these like a broader environmental things also impact directly them as well as their family and of course their baby.
Right. Yeah. So you meet with these women from prenatal to postpartum then?
Yes.
Yeah. And then you're just gathering all this data and then kind of like what's next.
Yeah.
Right.
Yeah. And so the beautiful thing about research is that there's so many different things that can come from it. So we are still collecting data, and as we're collecting data, we have different questions that we want to ask. So we may be targeting like what are these like different structural and environmental factors, and how are they affecting a specific mechanisms, whether that's something like emotion dysregulation or that's something like a different area of mental health. And so the goal is to use this data to ask questions that we want to get to the bottom of, and hopefully the broader goal is to publish these findings and publish these results and show like this is what we're finding in this population and what can be done about it. Yeah.
Is any part of the study also meeting with hospitals or doctors or OBGYN offices and things like that?
Yeah, we're not directly meeting with OBGYNs or hospitals, but our study is sometimes done in the hospital where the family would come in and we would do the study visit at the hospital.
Oh, okay.
But we're not directly meeting with the doctors.
Gotcha. Just because I'm sure there's also, like, that's a component of all of this as well, right?
Yeah.
Like the doctors, a white doctor not taking a black woman's health, regarding it in the same way, and that her risks may be different for certain, postnatal care, but so that plays a role in it too, I'm sure.
Yeah, that's an important point, and that's something that comes up during our interviews. We do ask about what was their pregnancy journey like, what was it like when they were experiencing care at the hospitals, what was it like when they were experiencing care at their appointments. And so based on what the parent decides to share with us, we do have that information, and we get that firsthand from the participants themselves, so they can recount whether that experience was really, really well or whether that was unfortunately not that well, and then we're able to use that data. Yeah.
And you said that you've always had an interest in, like, marginalized communities and the things that they're dealing with. What is it? Is there anything specifically about moms and babies and this, acute time in people's lives that really drew you in?
Yeah, I think that the pregnancy journey is so complex. It can be such a beautiful time, but oftentimes it can also be such a hard time. And so when we think broadly about this population that already faces different contextual and structural stressors, what are these things that affect not just the mom and how, her outcomes on this, but this baby as well that she's bringing into this world. And that attachment between mom and baby already has a wealth of research on how that eventually affects a child's life and their outcomes as well. And so, like, that intersection between mom and baby at this very, pivotal point is something that I also thought was interesting.
Yeah.
Yeah.
Is there anything else that you wanted to add about your research that I didn't think to touch on?
I think you got a lot of the main points.
Good.
But I think I'll just end up by saying that this has been a pressing issue for so long in terms of Black maternal health, and it's wonderful that there are finally studies that are not just looking at what are the risks, but what are the supports in this area as well, and how can we utilize information on both ends to help this population have healthy development.
Yeah, there's truly a history of this, unfortunately. Yeah, and I feel like it's only come to light recently that somebody started looking at the numbers and said, whoa, there's a problem here. Now we need to try and figure out some solutions.
Yeah. I think for the longest time, it was easy to just think, okay, well, obviously there's a big racial difference, so let's just attack that as this main area of why there's this disparity. But there's so much going on, and unfortunately people weren't looking into it for a very long time, and that's kind of been the case in terms of history and how this population has often been disregarded. And so it's beautiful that there is attention and there is a concern to actually figure out how do we help this population.